also can then stay informed as to what's happening in some of the outlying jurisdictions and how we are trying to respond to the questions and concerns, particularly as it relates to the health department. So I'm going to start very quickly. I think you may all be aware, I don't know, but we are doing daily briefings at this point from the county. They're at 10 o'clock in the morning. They're carried by Facebook. I'm not the best at this. I think it's Facebook Live. Anyway, if you go to Facebook and key in Hamilton County, Ohio, you can get on that stream and view them. They go about 30 minutes or so. Um, the purpose is to convey information, make sure people have the updated numbers. I get the daily numbers from Greg in the morning, and we convey that. So we've had Greg on. One day we had the sheriff on. We had some police chiefs on. This was all related to the stay-at-home order that came down from the health commissioner at the state level, Amy Acton, and the governor. And there was quite a bit of confusion about a couple of things. I'm going to get into that in a minute, but one concern was how it's going to be enforced. And so we had the sheriff in, and we had members of the Association of Police Chiefs. So Chief Bronson, Tillman, Crowell, and Schaefer were all here. Very grateful for their participation. From Fairfax, Woodlawn, Montgomery, and Madeira. And they were able to talk about a very common sense approach to enforcing that stay at home order. So I think it was really helpful for people to hear that. I'm very grateful for their participation. We've also had Nick talk about what's happening with EMA and emergency preparedness. We had Suzanne Birkin talking about the Council on Aging and the work they're doing in the senior community, both to give key information to seniors that need the help, and also key information to people that have the ability to volunteer right now to deliver Meals on Wheels and other supplies to some of our senior citizens who have been self quarantining for a couple of weeks. And then today we had the Health Collaborative in to talk about their preparedness efforts and their need for PPE, and how they're working in collaboration, all the hospitals together, all the hospital systems, to make sure that they are ready for a surge when it comes, because we know it's coming. So on Monday, we will have Andy Knapp from 911 and the Comms Center, in addition to the fire chiefs. And again, we're having some fire chiefs from the outlying jurisdictions come in and talk about how first responders are impacted by what's going on, and also how they're responding to the needs in the community and kind of what precautions they're taking. So again, I think it'll be really helpful. We're trying to do these in a way that where we're conveying information to the community, but also answering questions and concerns that we hear throughout the day as we move through this. So I want to talk about one thing. The stay at home order. As we all know, there is the stay at home order, and there's been some confusion about who should be closed from both employers and employees. And so, my understanding, and I know this is true, there has been different interpretations of that stay at home order depending on where you live in Ohio. So one county says you can be open, the next county might say you should be closed. And so I think that's been rather frustrating and hard to navigate, particularly for the public health department. And so I have asked the lieutenant governor and the governor, I was on a call yesterday, and asked if they would be willing to set up a statewide hotline to answer these questions from employees and our employers, because first of all, the stay-at-home order originated from the state, and I think it might be helpful to have them interpret what they were trying to accomplish through the stay-at-home order. I think generally we all understand we're trying to get people to stay home if they're not essential employees, but I do think there's some confusion. There's also inconsistency, and so ask them to take a look at that. John Husted said that they would see if they could allocate resources for the purpose. But since then, I've talked to the CCAO, has talked to the strike force, trying to get them to understand that not only is it confusing for all of the businesses and employees out in all your jurisdictions, but also the public health department is inundated with these calls because they're the ones that are trying to determine, what the enforcement looks like. And frankly, the public health department has lots of work to do when it comes to tracing people that have tested positive and all the other work that they're doing trying to respond to this crisis. And so I am committed to trying to take the load off of public health, and hope that those of you that are on the call that either are members of the Township Association, the Municipal League, all these other organizations can advocate collectively to the state to ask them to try to provide some relief here. It would be as simple as setting up a hotline to take the calls from employees about the specifics of the stay-at-home order. So I don't know if that's already happened in some cases, but I was on the phone for a long time last night trying to help people understand the urgency of trying to lift the load from our health department here in Hamilton County. So with that, I'd like to turn it over to Greg Kesterman. He is the Hamilton County Health Commissioner for an update by way of the numbers, Greg, and anything else you'd like to convey to the folks on the chat.
Well, thank you, Commissioner. And certainly our team has been very busy providing those answers to those questions the best we can. So well said. And we greatly appreciate your support and anything we can do to create some more stability across Ohio as we rule these state orders out to make sure it's fair for our businesses and to make sure that we're being as protective as possible for public health. With that, I did prepare a few slides. I'll run through them quickly to show some of the numbers. And if you could just, yep, perfect. So with regards to the numbers, ODH actually has created a new dashboard. And once again, coronavirus.ohio.gov is a great spot to check out to get the latest information every day at 2 p.m. Today in Ohio, we're at 867 confirmed cases with 15 deaths. Next slide, please. In Hamilton County, we have countywide, including Cincinnati, Springdale, and Norwood, we have 52 cases. Within our jurisdictions, we have 35 residents as of 2 p.m. yesterday with 5 hospitalizations. I've had several questions over the last week pertaining to community-specific information. And what I can share is that we are not disclosing that information, but over half of our, or let's see, nearly half of our communities in Hamilton County do have positive cases of COVID-19. We know it is community spread at this point, so it's just really important that people don't get a false sense of security that it's not in their community. At this point, I think it's safe to say it's throughout Hamilton County. The only other thing I'll mention is please visit our website for those numbers at 2 p.m. each day. And when there is a positive case within your community, I am alerting Andy Knapp and the Communication Center, and they are putting a special code in, and we're doing so to protect your EMS and police when they're responding to that house. Once again, I want to reiterate, though, anyone with flu-like symptoms, coughs, sneezes, even if they're not in that database at this point, we should be treating as if they could be positive, and we want to protect your workers as you're heading out into the community. The next slide shows a little bit about the new dashboard that ODH put together, and it shows the breakdown by community. Hamilton County is third in the state with regards to the number of cases. Obviously, Cleveland up in the north part of Ohio is where we first saw our cases, and they are certainly the highest. I believe they have over 200 cases at this point. Next slide. So just briefly again to spend a moment on prohibited activities and what's happening in the state of Ohio. We know that any kind of mass gatherings and gatherings of people are prohibited, as well as public amusement, social clubs, and non-essential. On the next slide, you'll see the stay-at-home orders cover a variety of those activities. And I circle as a household, and I think I might have mentioned this on Tuesday, but it's really something I'm trying to talk a lot about and to get out there to get people to understand. You know, we're all being stuck at home, and in the evenings, I see so many folks out and about and exercising, enjoying this beautiful weather that we're having, and that's amazing. But it's really important when you're out recreating and getting that energy out that you're staying together as a household. If you have children, it's really important to not allow those kids in close contact with the next door neighbor's kids, because that is how this thing is spread. When people are together, we spread this as and we help put fuel on the pandemic and make it go crazy. So really try hard to work and stay apart as a household, or stay together as a household, and don't allow those cross connections to continue. Commissioner Dreihaus did share on the next slide here. Yep. There are a whole bunch of businesses that are considered essential. Our office and my team of sanitarians are working very hard to provide additional guidance. We're working closely to align with the other health departments and to make sure that we're doing so yesterday we'll see between 6 and 8,000 cases per day when we hit our peak, which is expected at the end of April, early May. So the work we are doing now, though, we have successfully decreased the impact on the healthcare system between 50 and 75%. So I keep reiterating the work we're doing today is making sure that we have capacity in our healthcare system. And I just spoke with Dr. Fagans, our medical director, and he is reassuring me that our hospitals are actually fairly empty right now, which is a good thing because we've stopped those elective surgeries and we've done the things that we need to do to reduce the burden on our healthcare system and to preserve that necessary protective equipment. Our hospitals right now are in great shape, so we are ready when the surge comes, and we'll continue to monitor that closely and work with our partners. Those are all the slides I had prepared. I'll turn it back over to Commissioner Dreihaus.
Thanks, Greg. Why don't we go to Nick next, and then we will field questions after Nick speaks. So Nick, again, the Director of the Emergency Management Agency. Uh-oh, Nick seems to
Thank you, Commissioner Dreihaus.
There he is.
Again, we continue our mission to coordinate and communicate with the public, all of our communities, and all of our partners, public and private sector. We sent out guidance earlier this week that we encouraged, and my days are sort of bleeding together. We got some feedback. People didn't feel it was necessary. Some people didn't feel like they had a case or had a reason. I will tell you that the size and scope of this event, if a community in Hamilton County experiences no impact from this event, especially from a FEMA perspective or a reimbursement perspective, then that would surprise me. So we are recommending that all communities do declare a state of emergency. We've sent the county declaration as an example that they can use to do that. It is technically not required for federal assistance. However, as we stated in our email, it does provide clear notice that you either do or may require assistance during this event. It may also, not sure how your laws and authorities are written, it may also invoke local ordinances or powers that may be useful, especially around purchasing or meeting requirements. The Ohio legislature recently changed meeting requirements, so they need to implement those. Again, we provided the county declaration as an example, and I provided guidance to the community this morning, so if you have any questions, we're available to answer those. And then if you do declare an emergency, we do encourage you to forward a copy of your declaration to us for our record. These are the communities so far that we have copies of the declaration from. We have about 21 communities out of 49. And so, again, if you declare a state of emergency, one, we encourage it. Two, if you send us a copy. Continuing on, so talking about FEMA public assistance. So with the disaster declaration, we have sent out information a couple of times on what FEMA is reimbursing, and it's quite expansive. Which is why we're encouraging you to track your expenses. Right now, the federal government is offering 75% reimbursement for eligible expenses. It is up to the state's discretion whether or not they provide their usual 15% match. So at a minimum, you can apply for, and if accepted by FEMA, receive 75% of costs reimbursed to you. And those are outlined in the information we previously sent to all. One thing we do need you to do now, to go back to that slide, please. One thing we need you to do is complete the request for public assistance form that we sent you and write your DUNS number somewhere on that and get that submitted to EMA Recovery at dps.ohio.gov. Please do that now so they can get you in the system. And then, as always, track your expenses that may be related. Next. I know that the state recently put out a phone line that people can call if they want to donate. I did call the state this morning and asked that any donations in this area, Hamilton County, be directed to us. And as I understand it, they will do that. We do encourage people to continue to call us. We also ask that we have this information available that you can put out on your social media, that you can put on your local website. Please help us get the word out to the industries in your communities. We have been, I think, fairly successful in getting the word out through the media. But again, you are the boots on the ground, if you will. And so if you can help us get this information out, we would greatly appreciate it. We have had success. This effort is shared regionally. The stuff that we are collecting is really valuable, especially to nursing homes and other providers that don't have any other sources of PPE. And finally, so we'd like you to help us educate the public. So both the Commissioner Dreihaus and Greg have stated that we need to get the word out to the business community about what is essential. Getting a lot of calls, we're getting a lot of questions, and it really comes down to using common sense. There is guidance out there. I was watching the Lieutenant Governor yesterday and the day before talk about that they've outlined what are essential businesses. And it really comes down to common sense. So if you just share that message to go there, that would be great. A lot of our efforts right now are focused on community response. A lot of public health efforts are focused on community response. And we feel like the frequently asked questions and the order itself provide quite a bit of guidance on what is a business that can fail. And then finally, help us by being a preparedness ambassador. Continue to set an example for the public by sharing trusted resources. And it's really great as Ohioans if we can share our information, Hamilton County Public Health, City of Cincinnati, the other health departments, ODA, CDC. There is consistent messaging going on about the need for social distancing, avoiding large crowds, following the orders issued by the governor. All this information is out there, and we just really ask as local elected and appointed officials that we continue to share this information. Finally, I'll just close by saying that my email is always open to you. My phone number is always open. My cell phone is never an email that I send. We are here to help if we can. We are now in charge of distribution of the Strategic National Stockpile at the request of the Public Health Department. We've sent that information out to your first responders, communicating with the hospitals, and other eligible applicants for that. However, that personal protective equipment is very limited, and so we are distributing as much as possible. It is never the full order that somebody asked for. It may be a while before we get there. So if you have any questions about that, you can contact our office. We'll explain that process to you. But this is a joint response. It's going to take all of us at the government level working with our residents to communicate the need to flatten the curve. I see that behind Commissioner Dreihaus's head there on her handy dandy chalkboard. But it really is important at this point. All of my staff are working. We appreciate the messages of support that I've received from you. In our agency, it's a team effort, as it is in public health and everywhere else. We've worked real hard to put together a top-notch emergency management program for you. At the same time, you're sending compliments. If there's anything you can see that we can improve on, anything you need, please don't hesitate to reach out to us. And we'll do whatever we can to help you. So thank you.
Thanks, Nick. Yeah, I appreciate you noticing my subliminal messaging back there. I've been putting things on my chalkboard. I had something on there last week. I don't want to ruin the surprise if you go back and look for it. So Nick, while we've got you queued up, there are a couple questions for you. So Nick, is there an ICS form or other standardized form that we would best be used in the situation for tracking dispenses for future reimbursement?
So we do not have one. I'll talk to my staff about the one that we're using, but it's literally taking the categories that we've sent out to you, and then what we have done is in the county we've created a code that can be put on expenses so that we can search by that code as we go forward. I'm not sure what the code is, but that's how we're tracking it so that we can pull them out later. If you have just a few, then just a simple spreadsheet. So my philosophy has been and always will be keep it simple. So at the county, we're a bit more complicated in the expenses we have, but if you have less complicated, then really a simple spreadsheet of who, what, how, where, and when you had the expense would be, I think, the best way to track those.
Also, Nick, how should we be submitting for reimbursement?
So the guidance is in the email we sent you. So right now, the first thing you should do is submit the request public assistance form with your DUNS number to the state. And then we're actually should be putting out information next week on when and how you can submit for reimbursement.
All right, one more. Our local DOD was requested to give their surplus emergency
Originally, what the guidance was from public health was to the people that were holding the pods. So the pods were stored in the local communities, but under the ownership of Hamilton County Public Health. The guidance that was sent out was to take out what they needed and then transfer the rest of it to the health collaborative for use. So at the end of the day, all of this equipment comes right back to our communities to help nursing homes, people who are working with the developmentally disabled, and other providers. So we have criteria for who can ask for the PE from the health collaborative. But always remember that those pods were paid for and developed by grant money received by Hamilton County Public Health. We did allow first responders to take what they needed, and then we asked for the surplus to be given out so that we could share it community-wide.
Greg, did you want to weigh in?
No, I think that's accurate. If you still have pot supplies, you certainly are welcome to use them for your police and fire, and make sure your community is protected. The goal here, we know the highest need right now is with our hospital systems, and then we know the second highest needs kind of tied between the long-term care and EMS folks that need to protect themselves.
Thank you. Nick, I think this one's for you. This is from Jeff in Springdale. 2 of our community groups, the Weavers and the Artists Guild, got requests from 1 or more nursing homes for a handmade fabric mask as they have few or none. Their current alternative is nothing. I got a question if this is a good idea to support. Currently, Drake or another facility offered to sanitize them initially before providing. Obviously, these would not manage anything more than large particulate, but it is better than what they have, ?
Nick, I can weigh in if you'd like.
Sure.
So, what I'm hearing from our hospital systems, they're not ready to accept homemade materials at this time, although they're continuously evaluating that based on what they have available and the need within the systems. And it's really an individual choice between each different provider. So if there is a nursing home asking and is comfortable with using a particular type of homemade mask, then they are certainly welcome to make that decision for their medical staff. And they would do so based on their need and based on what they know as far as the specs that some of these homemade crafters are using. So while there's not been a widespread call in Hamilton County for homemade sewers to begin this process, certainly we might start to see some long-term care facilities make the decision.
And I'll add, Commissioner, that the health collaborative is still accepting requests for what personal protective equipment we do have available. A lot of it's surgical type masks, which again are better than the cloth mask. So I will have the link to that online request form resent to the community so they can give that to their nursing home providers, and they'll provide. I know it won't be their whole request, but we'll provide it until we run out.
All right. All right, so I'm not the best at this. Regarding masks, thanks. This was direct request that helped. Okay. So I'm going to go back up to another one. Jeff Aludo is about to get on the line. So Jeff Capel, I've not forgotten about you. But Ruby Mumphrey says, when it comes to tax offices like H&R Block that are offering drop-off service, some other tax businesses not open, are they indeed considered essential financial services? And that is from Mayor Mumphrey, Village of Lincoln Heights.
This is Greg Kesterman. I believe that there are some financial services, including tax offices, that meet the exemption, but I'd have to specifically see what that guidance is in the director's order. Mayor Mumphrey, I will get back with you and and I'll let you know what I find out. And then I'll also address it next Tuesday when we meet again as a group.
Thank you, Greg. Nick, I think this is you. Do municipalities need to submit both the PNP facility questionnaire and the request for public assistance forms?
So if I understand your question, the RPA form goes to the state, and the PPE request form, we've sent guidance to our first responder community on, we have an online link and another form they need to fill out to request PPE for their first responders. Does that answer your question?
Well, PNP form is a private nonprofit form, she said.
So the state will do briefings for eligible applicants. We're waiting on the schedule for that briefing schedule for the eligible. So yes, there are certain nonprofit schools, others that are eligible for reimbursement by FEMA for extraordinary expenses. So that hopefully those webinars the schedule will come out next week.
Thanks, Nick. Going back up to the top, I've got a question from Jeff Capella. Jeff Aludo, are you on the line?
I am. I'm not on a webcam, but I am online.
All right. You know what, Jeff? Do you have anything? I should have asked you at the top to give any comments or updates from the county.
No, again, having not been on the call, and I apologize. I was on a conference call with the other urban municipal counties in the state. So I apologize that I wasn't on at the beginning. So without rehashing anything in general, no, I think just so folks know, we are currently operating with probably about 60 to 70% of our workforce from home. We've put forward a lot of different operational modifications to make this work so that we can keep balancing provision of service with public safety. We obviously are dealing with a lot of independently elected offices as well, from the judiciary to the prosecutor, the recorder, clerk of courts, et cetera, who have their own service lines to maintain. And we are keeping track, and we're coordinating quite well with all of them and keeping track of the different implications to their offices. So Denise, you probably have indicated this, but people can go to our website, www.hamiltoncountyohio.gov, and find a list of all county activities to get a better understanding of which services have been modified, in what way, what building closures have occurred, and which buildings have restricted access, that type of a thing.
Right. And so, in other words, still open for business, but a lot of it's happening virtually. We do have one access point on the first floor of the county the Todd Portune Center for County Government, the Todd, as I like to call it, where if people do need documents that cannot be sent to them via email or scanned, then there is an access point down on the first floor where if someone were to call, say, planning and development and say, they need access to a certain document, then the folks upstairs will run it down and hand it through that access point on the first floor. And so I want to say that we're trying to limit access for the safety of the public and for the employees in our buildings, but do recognize that there are certain very limited situations where people need actual documents. And so we're trying to be as responsive as possible to that while staying very safe. So Jeff, we've got a question. With news that the FC Cincinnati Stadium is still being constructed, who has decided that a new soccer stadium is essential while other businesses are shut down? Is someone monitoring to ensure that they are practicing social distancing and not consuming masks that would be better utilized by first responders and medical personnel?
Yeah, so I don't know that I can speak entirely to just the FC Stadium specifically, but I can say that the governor's order, which included an outline of exemptions to the stay-at-home order, the shelter-in-place order, did include a fairly broad exemption for construction. And I believe, without having it directly in front of me, it listed construction and parenthetically listed several examples of that, but also said, but not limited to. So there was a pretty broad exemption given for construction activity in the state. So while I can't speak specifically to the stadium itself, I can say that while we are not yet coming up out of the ground with the garage related to that stadium, we are continuing with some pre-construction activities out there, specifically because public works construction was one of those listed specified exemptions. So again, I can't speak for FC Cincinnati, but I can say that I would imagine that they are interpreting that the governor's order in the similar manner to which I believe we did, and that was that there was a pretty broad exemption on construction.
Thank you. I don't see any other questions in the chat. Does anyone else?
Greg Kesterman, I just wanted to share, I spoke with my team in environmental health regarding Mayor Murphy's question and tax offices, and those are considered exempt as they are part of the financial system. So in those cases where some services are providing drop-off only service, we commend them, and they are doing the best job ever for social distancing. And that's really what we're expecting everyone to do, is the best job they can in all areas with social distancing. Other offices, if we're seeing cases where there is a failure to social distance, feel free to report those to hcph.org, and my team will follow up first with a phone call to try and discuss what's expected. And then secondly, if that doesn't work, we'll do an on-site inspection. Thank you.
Mm-hmm. All right. So we have no other questions. We've got a couple thank yous, which is nice. So thank you all for being on the call. Thanks so much to Nick and Greg and Jeff. These are trying times, as we all know, but we are doing, I think, our best work in Hamilton County. Thank you for all our local partners for helping in the effort. If you have any questions, please feel free to convey those questions to any of us. We are trying to do our best to make sure everybody's well informed as often as possible. So we really appreciate your partnership. Stay safe, and we will see you next week. Thank you.
In support of the CARES Act, Americans are facing a public health crisis that is an unprecedented threat to the health and safety of our communities. Hospitals are struggling to care for our communities and get the protective equipment they need. The pandemic has brought schools, businesses,